I'm Angelo Giardino. I'm the Chief Medical Officer at Texas Children's Health Plan, and today we'd like to discuss with you two serious infections, influenza and RSV. The first one that we'll talk about is influenza. The timing of influenza or flu is unpredictable and it varies widely. Most flu activity in the United States peaks in January and February, but it can start anytime. As a result, we ask that the providers in our network offer immunization as soon as the influenza vaccine is available. As you may have heard, in this season, flu has started early. So we're really encouraging the primary care physicians and nurse practitioners to ask the families to have their children vaccinated now. As healthcare practitioners, you can lead the way in terms of getting flu vaccines. So we're asking that you and all of your staff, of course, get vaccinated and set the example. In addition, please offer the vaccine throughout the season. We certainly would like people to receive the vaccination at the beginning of the season, but there's good epidemiologic evidence that it's valuable to receive it throughout the season. And finally, it's important to encourage parents and caregivers of children under 6 months of age to get vaccinated, since we can't vaccinate the children under 6 months of age. So if you look at the CDC recommendations, they would like us to have children between 6 months through 8 years of age vaccinated. In the first season that the children receive the vaccination, they should receive 2 doses. Thereafter, they just need 1 dose. And the graphic on the screen will explain some of the details of that. So just to sum up, influenza is a really serious infection. It's something that we have a vaccine against, and we're encouraging you in the Texas Children's Health Plan network to vaccinate all of the children 6 months through 8 years and beyond. Another infection that we're worried about this season is respiratory syncytial virus, or RSV. We do have a product, Synagis, that can offer some passive immunity. Based on statistics, the RSV season varies by county in Texas. So in the eastern counties that we're in, the season will run October through the end of February. In the western part of the state, it starts a little bit later in November and ends in March. So what we're asking our providers in the Texas Children's Health Plan network to do is to consider administering Synagis to children who are under 2 who have chronic lung disease or chronic heart disease. And then for premature infants, it gets a little bit complicated. For premature infants who are 28 weeks premature or less and who are 1 year at the beginning of the season, we would like them to get immunized. And then other prematures, based on their level of prematurity and the age at the start of the season, there are recommendations which are displayed on the screen which you can follow. Synagis requires a prior authorization, and our pharmacy benefit manager, Navitus, has a process in place, and the website is listed on the screen, and there's a form to complete that allows you to designate the level of prematurity, the age of the child, and if there's any chronic illnesses present. So we would ask that you would seriously consider who is at risk for RSV infection in your practice and who would be an appropriate candidate for Synagis, and then request that prior authorization from Navitus, which is our benefit manager. So in conclusion, respiratory infections are a significant risk for our patient population. We look forward to working with you in combating these infections and would love to hear from you if there's anything that we can do to make that process easier. Thanks for tuning in today, and we'll be talking to you later.